Our next speaker is Trina Thornhill. If Trina's here. Welcome, Trina. When you're ready, thanks. You have 3 minutes.
Thank you. So thank you for the opportunity to come and speak with you today. The topic of vaccines and vaccine hesitancy has been getting a lot of media attention. Unfortunately,
Can't hear you.
sorry. Unfortunately, by careful manipulation of media, they are trying to successfully divide a population against itself in fear through misinformation. I'm here to defend our right to informed consent, a parent's right to make medical decisions for their children, and body sovereignty. In 2009, I was pregnant with my first child. Being fully vaccinated, or according to government standards, being fully vaccinated at that time, I never questioned vaccines or vaccine safety, and I blindly trusted. So when I was told I needed the flu shot to protect my unborn child, I trusted and took that shot. My health began to change after the flu shot. I was assessed for fibromyalgia, rheumatoid arthritis. Things got worse. Food intolerances developed, facial paralysis, projectile vomiting, beef and egg. I developed allergy to penicillin, and then I had adverse events to all antibiotics, so I can't use them anymore. I was informed by a Canadian medical doctor that neomycin, egg, and bovine are actually in that flu vaccine. What I did not know was this vaccine was not approved for us. It was not approved for use during pregnancy. Myself and other women were the test subjects. I was not provided at all informed consent. Fast forward to this year in Washington, D.C., February 11th, 2019, in response to the Freedom of Information Act lawsuit, the FDA has admitted for the first time the government agencies, including the CDC, are recommending vaccines for pregnant women and have neither been licensed for pregnant mothers by the FDA nor tested for safety in clinical trials. The manufacturers of the flu and the DTaP vaccines warn against their use for pregnant mothers since their safety has not been established. Package inserts state that it is not known whether the vaccines will harm the unborn baby, and there is significant data onto the use of using this for pregnant women to inform vaccine-associated risks. Long-term safety studies have not been designed to detect vaccine-related fetal injuries, but a 2017 Fraser study of over 45,000 women published in the JAMA Pediatrics showed us elevated risk of birth defects and a 20% higher risk of autism in children whose mothers received a first-semester flu shot. When did I get mine? First semester. So now I will address the Toronto Board of Health. Each one of you have a platform here. You are to support people new to Canada, support and fight for equality, children, the environment, the marginalized. The same rights for all. You want that for everybody. What are we doing here trying to remove exemptions for those who actually did what was required of us and then had an adverse event to that vaccine? So, no one in this office, no one right now is actually up to date, not one of you. We are all not up to our children's schedule. Do you understand what that means? You're asking for our children to have more vaccines given to them than we ourselves were ever given. So, my question to you is, a doctor needs consent, nurses needs consent, a pharmacist needs consent. We do not need consent to say no. Who is going to write your exemptions? Who is legally allowed to ensure us we all need permission to say no?
Mary, you're just over 3 minutes. I'm going to ask you to wrap in a sentence.
Thank you very much. Either stand behind your recommendations and take personal responsibility for the consequences of vaccination, or stand down. I do not consent.
Thank you, Trina. Any questions? Seeing none. Our next speaker